Welcome to your program of choice, Health Affair on AIT, a platform where we focus on critical health challenges, issues of women and children with a view to finding lasting solutions. I am your regular anchor, Oshuomowa Daniels. Hypertension, according to statistics from the World Health Organization, WHO, is the most prevalent non-communicable disease responsible for so many deaths globally. Over 1 billion individuals are currently living with the condition, and the figures likely to hit 1.5 billion by 2025 if urgent steps are not taken. For more information about hypertension or to avoid having it, stay tuned with us on the program. We'll be right back after the news segment.
The largest global AIDS organization, AIDS Healthcare Foundation, AHF, is transferring its knowledge from the fight against HIV/AIDS to the war against COVID-19. The digital campaign with hashtag #VaccinateOurWorld and Vow Now is calling on world leaders to take the following actions. Promote far greater international cooperation as a driving force for ending COVID-19 pandemic. Ensure countries are 100% transparent in sharing information and data. Produce and provide 7 billion vaccine doses worldwide within 1 year. Ensure companies and governments waive or suspend all COVID-19 vaccine patients during the pandemic. And for global COVID-19 vaccination effort to secure $100 billion from G20 countries. At the Vaccinate Our World Pan-African virtual discussion held on Wednesday, the 19th of May 2021, insight was shared and messages were imparted, creating a synergy of collaboration and a practical guidelines of manageable steps. World leaders should be considering to vaccinate world citizens and stop the spread of COVID-19. Issues of moral gains through the waiving of intellectual property around antiretrovirals, art, therapy for HIV infections. How removing technical regulations information system would enable for better management of vaccines. Experts at the conference noted that if the whole world is not vaccinated, Africa, along with all developing countries, runs the risk of becoming a breeding ground for new variants of coronavirus. Overstocking of vaccines by countries in the developed world, as well as restricted access of developing world to vaccines that has left many unprotected, giving coronavirus time to mutate beyond vaccine effectiveness, came to question. Panelists at the Vaccinate Our World Pan-Africa virtual discussion include Alan Malechi, Executive Director of Kelin, and the Board Member Development County NGOs of Global Fund Board, Christian Happy, Professor of Molecular Biology and Genomics, and Director of African Center of Excellence for Genomics of Infectious Diseases, Professor Jeffrey Mfaleke, Vice President of the South African Medical Research Council, amongst others. The outbreak of Ebola virus in 2014, the threat of new variants of the coronavirus, and the possibility of a third wave of the COVID-19 pandemic in West Africa necessitated this meeting of health experts from across the West African sub-region on the need to access a response to the COVID-19 pandemic so far and ways to move forward. Two critical points were identified for effective epidemics control, which include strengthening the diagnostic capacity through improved laboratory system.
Important steps in tackling epidemics is the ability to not only diagnose them, to detect them, to also know the type of viruses or whatever it is that you're dealing with. And that's where laboratories are. And so it's not just a question of waiting for the epidemic to happen, but it's also to continually carry out surveillance through these laboratories, strengthen the laboratories in terms of capacity, having the people, having the quality assurance, having the equipment.
It will not be the last of such that we are likely going to have. So we need to act fast and be proactive in our activities and actions.
Blaming the safety concerns and anxiety about the COVID-19 vaccines on the short time with which they were produced, Professor Stanley Okulu and other participants encouraged Africans to believe in their health authorities and get vaccinated.
This science of using mRNA, which is a type of genetic modeling to stimulate the antibodies in terms of the body, is something that was developed in 2014. It is a well-accepted technology. It's not something that suddenly appeared because of coronavirus, but now it's being used to develop vaccines quickly.
People should keep being faithful to their institutions, listen to what the institutions are recommending to keep the virus away from us.
There may be a lot of controversies, but again, what we just want Nigerians to know is that we should have confidence in our own health workforce, because none of the health workforce will give something that will be deleterious, that will have adverse event to the citizens of the country.
4 West African countries, namely Burkina Faso, Cote d'Ivoire, Niger, and Nigeria, were represented at the meeting.
The Pharmaceutical Society of Nigeria, the umbrella body of all pharmacists in the country, has called on the public and media to disregard claims by one of our members, Dr. Samuel Adekola, on the issues legalizing Indian hemp for medical use. Dr. Adekola had on a TV program made some unsubstantiated claims on Friday, 21st May 2021, that Nigerian pharmacists support legalizing Indian hemp for medical use. In a press statement by the National Publicity Secretary of PSN, Ijoma Oke Iworum, it noted that though some scientific evidence abound on the use of cannabis for the treatment of some terminal diseases like cancer, but not the regular street cannabis. The December 2nd, 2020 meeting of the United Nations, severally referred to on that TV interaction, according to the statement, was for rescheduling of cannabis from the dangerous drug list and not for immediate impact on loosening international control, as countries will still have jurisdiction over how to classify cannabis based on research and political will for effective control. In a society where substance abuse has resulted in an increased rate of suicide and criminal activities, the Pharmaceutical Society of Nigeria shares the concerns of most people who have expressed worries over the claim, as it's premature and assaults public health and societal sanity. The regulatory body of pharmacists says it's working with the National Assembly to see that the pharmacy bill is passed into law to provide legal basis for commensurate sanctions on pharmacists who fall short of ethical standards and handling of poisons and psychotropic substances. Members of the Sing and Smile Club of the Smile Train there at the Lagos University Teaching Hospital, Idi Araba, having fun in the spirit of the 2021 Children's Day celebration. The Sing and Smile Club initiative was designed to complement the speech therapy treatment services for palate speech patients.
Smile Train knows that the Cleft, children born with Cleft, are all part of our community, and that is why we have taken it upon us to celebrate them, and we're doing that as a part of the spirit of the Children's Day celebration in Nigeria, and that every child, including the children born with cleft deformity, are celebrated today. It has not only brought the families together, but it has also built that level of confidence for the children to network, to make friends, to interact, and of course, it has brought the whole people in the cleft ecosystem, the partners, and even our volunteers, the journalists, the GSK employees, the Smile Train employees. So it's been an exciting time, and we've sung, we have celebrated, and we're so excited.
Speech defect is one of the major challenges of cleft palate patients.
My mom told me when they came back to me, they felt very embarrassed. A lot of people told them to go and drown me, that I'm nobody, I can't be someone in life. But thank God to my mom, who said no. Personally, growing up was not fun at all. It was not fun. I grew up with bitterness and hatred in my heart. I spent my childhood in isolation.
There should actually be a barrier between the mouth and the nose when you open the throat. But as you open it, you see that there is a big gap in cleft palate. So that barrier is not there any longer. So there is direct communication between the mouth and the nose. So when the food goes into the mouth, some of it will be coming out through the nose because there is now an opening going into the nose. There's nothing blocking the food from going into the nose. So that's why some of it will go into the nose, some of it will go down the throat. There's a lot of social stigmatization because some people believe that these children, they are evil, or the mother had given birth to the child because of either her wayward ways or because of a curse on her or on her family. So they tend to either hide the children, and some of them even kill the children.
Cleft is just a congenital defect, means that children can be born with it. So there is no spiritual connotation to it. They are not omanje, they are not witches, they are not evil spirits. It's just that they are born with it. And as of today, the solution is right here in our doorstep by a simple surgery that could last like 45 minutes and cost as little as $250. That child would go through a life-transforming surgery that is completely free of charge, high quality and safe, and all paid for by Smile Train.
Beyond the inclusion that should exist on the Children's Day celebration, experts are also calling for an end to stigmatization against persons with cleft lip and palate difference if Nigeria must achieve the universal health coverage goal of leaving no one behind.
Between January 2020 to March 2021, Lagos State, according to data provided by Public Prosecution, Ministry of Justice, reported 268 cases of rape, out of which 213 were charged to court and 135 sexual offenses concluded in 2020. The need to find a lasting solution to sexual and gender-based violence that increased at a geometric progression with the COVID-19 pandemic bettered the virtual response and referral system on Thursday, 20th May 2021.
Today's launch of the SGBV virtual referral system is particularly a right step in the right direction. Long overdue, but a timely intervention designed to move with the times as it relates to leveraging on technology towards providing prompt and necessary services to survivors of sexual and gender-based crimes.
The Virtual Referral and Response Service, VRRS, launched today provides just that. I applaud the initiators and all implementing partners for this innovative solution towards effective help and support for victims of gender-based violence. I applaud all the efforts of the Spotlight Initiative by the UNFPA, the DSVRT by the Lagos State Government.
Thus, the launch and wholesale implementation of sexual and gender-based violence virtual system will not only make reportage on GBV possible, but with or without physical contact, but also make it faster. Same goes to the treatment and therapy.
Speakers called for more awareness campaign so that people at the grassroots can benefit from the initiative.
And restore her. We must do so now. I'm eager to advocate for effective help for victims and sufferers as it's being orchestrated here today at this GBV virtual referral response service. I advocate for awareness of GBV to enlist more people within the communities to join the fight against gender-based violence. I'm also eager to advocate for swift and effective punishment for the perpetrators to the full extent of the law.
We reached out to the United Nations Spotlight, the European Union Spotlight funded initiative, particularly UNFPA, and we collaborated to establish this gender-based violence virtual referral and response system. So the idea is this: we now have a toll-free line operational 24 hours a day, 7 days a week during holidays. Irrespective of where you are in Lagos State, you can access support, you can access legal support, you can access information as to what to do immediately an incident occurs.
Welcome back. Out of the 1 billion individuals currently living with hypertension, Nigeria accounts for over 1.5 million. Hypertension, commonly known as high blood pressure, is a condition in which the force of the blood against the artery walls gets too high. I spoke with some experts at an event in Lagos to mark the 2021 World Hypertension Day. Please listen to them and learn everything you need to know about hypertension.
When the heart, which is the biggest blood vessel in the body, contracts, it generates a form of tension. And that tension at the highest level strikes the wall. It is when that contraction, at the peak of contraction, that tension on the wall, when it is measured, is what is called the highest blood pressure level. And that is referred to as the systolic blood pressure. After contraction, the heart then relaxes again. At the lowest level of relaxation as an elastic vessel, if you measure the blood pressure, that is what is regarded as the lower blood pressure, which is called as diastolic. So when doctors measure the blood pressure, we cannot directly go to the heart to measure it. We measure it at all the other blood vessels in the body, because all the other blood vessels are they emanated, they are distributed all over the body. So when you measure it at the arm, you measure two figures. The highest level, systolic, and the lowest level, diastolic. And that is why it is recorded as blood pressure, both the systolic and the diastolic. But let me also add now that it is not only the doctors that measure the blood pressure, healthcare professionals measure it, all individuals also can measure their own blood pressure. Ideally, we expect it to be 120/80. The blood pressure tends to increase with age. And when it increases with age, as of definition of today, we accept that we would like your blood pressure to be lower than 120 to be lower than 120/80 as the ideal blood pressure. But this is not what you find all over, especially with people who have developed high blood pressure. You want your blood pressure to be lower and to be close to lower than 140/90, and the closer you are to 130/80 or to 120/80, the better we are. The more you age, the more your blood pressure increases. So you can't change that, but you can do something about it, because it's not everybody that ages develop high blood pressure. And diet is central to hypertension. When we talk of diet, the number one ingredient we talk of the diet is salt. Salt, the more salt you take, the more tendencies for you to have hypertension. And as scientists, we recommend that you should take salt less than 5 grams daily in your diet, in your food. Or you should not add salt to when you prepare your food. There are some ingredients that are laden with salt, especially those ingredients that are available in the kitchens. You should not add them to food. A lot of them are laden with salt. So if you want to avoid salt, there are certain vegetables you can take that can also give you the same amount of taste for your mouth. So try to avoid salt as much as possible. Then we also talk within the diet, we talk about too much fat in the food is also bad in terms of when you are talking of diet, because that also can affect the arterial wall, the walls of the arteries. It can make them more thickened and can make also more thickened to hypertension. We talk of physical activity, sedentary activities. Do not sit for a long period. Try to exercise. And we say exercise, which is physical activity. When you do physical activity, like at least we recommend for an adult at least 150 minutes per week. If you can do exercise of 150 minutes per week, like 30 minutes every other day, depending on whatever you do. If you walk, if you jog, if you swim, that's a form of physical activity. So that is also very good for you. Then we talk of alcohol. Alcohol consumption also affects the amount of content, your blood pressure. We talk of smoking of cigarette. Also, we talk of diabetes. There are certain conditions like diabetes is very close to hypertension. Try to look at your sugar content. It's not too excess. The more excess sugar you have, the more tendency you have hypertension, and the more likelihood of your blood pressure going up.
Blood is a medium through which essential nutrients and oxygen are taken to various parts of the human body to enable the bodies and the tissues to function normally. The blood pressure results from the pump action of the heart, and this pump action generates pressure. The blood pressure is normally from 120/80. It could be higher in some individuals. Usually when it is more than 140/90, the way it is recorded, you will say that the individual has hypertension or has high blood pressure. And the individual will need to be seen by a doctor or a health worker who is trained in that area to know exactly what to do. Hypertension is when the blood pressure of an individual is 140/90 or higher than that. When the blood pressure is recorded in an appropriate way and found to be at this level, it needs a doctor or a specialized health personnel who is trained in area of hypertension measurement and the management. This individual is expected to be investigated and given appropriate medication. When the blood pressure is not lower to appropriate levels, it causes a lot of problems. It can affect the heart, it can affect the kidneys, it can affect the brain, it can affect the eyes. And it is important to have it reduced to normal levels as soon as possible. Over 90% of people who have hypertension, the cause cannot easily be found out, and these are majorly genetic, run in families. From 5 to 10% of individuals, some known cause can be found out. Some of these known causes can be remedied, but it is important to look out for the other risk factors apart from the genetic, to look out for people who are obese. Being overweight can predispose to hypertension. Being sedentary can lead to that. It's been noted that hypertension is a great burden. In Nigeria, for instance, and in most parts of the world, it is the most prevalent non-communicable disease, and it is responsible for so many deaths globally. Over 1 billion individuals all over the world are hypertensive, and it is predicted by 2025, this figure will rise to 1.5 billion. It's also been found that there's a low level of awareness. Not up to 50% of individuals all over the world who are hypertensive are aware that they're hypertensive. In low and middle income countries like ours here, this is even much lower than 40%. Measure your blood pressure accurately, control it, and live longer. It's been found that a good number of people do not even measure their blood pressure, and when they do, some don't measure it accurately with recommended machines for recording the blood pressure, and by those who are trained to be able to. The automated blood pressure machines that are coming out now, the good ones, they record and they give you the figures. The figures do not depend on individuals reading it and interpreting it the way they want. So you need to measure the blood pressure accurately, and then of course seek the services of a health care personnel that is trained, a doctor or any other that is trained in that area.
My dear Lagosians, I am Dr. Ibijoke Sawolu, the First Lady and TB Champion of Lagos State. Do you know that 18 Nigerians every hour die of TB and that more Lagosians are at risk every day? Tuberculosis spreads from person to person through coughing and sneezing into the air. Your health is a great concern to me. If you have been coughing for more than 2 weeks, having chest pain, tiredness, loss of weight, or night sweat, please visit the nearest health facility for testing and treatment. They are free. If you test positive, start and complete your treatment. Do not discriminate against tuberculosis patients. Let's support and encourage them to access free quality care. You can protect your family and community from the spread of tuberculosis. Go for the screening now and live a healthier life. Join the fight. End tuberculosis in Lagos. Ìgbéga ìpínlẹ̀ Èkó, àjùmọ̀ṣe gbogbo wa ni.
If you are just joining us, the program is Health Affair on AIT. Diet is vital for healthy living. What you eat can either make or mar you. That is why we give our viewers information about the nutritional value of fruits and different food items. Watermelon is a plant species in the Cucurbitaceae family, a vine-like flowery plant. It is a highly cultivated fruit worldwide, having more than 1,000 varieties, but originally domesticated in West Africa. It is grown in favorable climates, from tropical to temperate regions worldwide, for its large edible fruits. The sweet, juicy flesh is usually deep red to pink, with many black seeds, although seedless varieties exist. The fruit is eaten raw or as an ingredient in mixed beverages or taken as juice. Watermelon contains about 92% of water, 6% sugar, and very low in fat. This refreshing fruit has a lot of nutrients such as vitamins A, B, and C, which makes it an antioxidant. 100-gram serving of watermelon fruit supplies 30,000 calories of food energy, fiber, appreciable amount of minerals like potassium and magnesium. Watermelon is widely loved for its hydration and immune boosting properties. Taking watermelon helps in quick heart recovery, lowers blood pressure. It would be a good idea to have a taste of this wonderful fruit every day. We make healthcare consultation easy and closer to you on our clinical segments. Now it's time for our perception segment, an aspect where your opinion counts in our efforts to shape the nation's health sector.
How can those that are not yet into hypertension, how can they stop it? How can they prevent it? We say by measuring their blood pressure. My mama in the village, how will she measure her blood pressure when she has not even gotten enough food to eat? When there is no primary health clinic, like you have said. Even in Lagos, and you please work towards reducing the price of these machines used to measure the pressure for these old people to have it.
This is where we wrap up the show today. If you have benefited from it, please call your friends to join us same time next week for another exciting edition of the program. My name is Ushomowa Daniels.